Hey, good morning. It's been a while since I've done one of these videos. We've been so busy at myLifeSite with a lot of other really exciting things that we're working on that I can't wait to tell you about. But it's a beautiful spring morning, sun's shining through, and I just felt like this would be a good morning for a video. But particularly because there's a question that we've gotten a couple of times recently, so I thought it might be of interest to others out there. And this question really is about qualifying from a health standpoint for a continuing care retirement community, often referred to as a life plan community. And so you may have heard people say that, that if your health needs advance to a certain point, or if your health declines to a certain point, that you may not qualify or may not be able to move into a continuing care retirement community. And while that is true generally, it's like most things. There's some nuance there, and there's some exceptions and things like that. So that's what I want to spend a little bit of time on. So first of all, when CCRCs are doing a health evaluation, typically the how in depth they get with that is going to depend in large part on the type of contract they offer. Now, you can learn more about those contracts in other videos that I've done, which are on our website, as well as some written content that's on there. And so those contracts, some of them, as you may know, offer discounted rates for healthcare services and assisted living services. And sometimes those discounts can be really, 30, 40, 50% discounts sometimes on the cost of care. And so those contracts, for residents that have those contracts, you have to have a continuing care contract to get those discounts. And even aside from the discounted cost of care, there's other benefits of having a continuing care contract. In many cases, a resident would receive, for example, financial support if they were to, let's say, run out of money paying for care and things like that. So with that continuing care contract, there are a number of different benefits. Generally, the residents who have those contracts, they have priority access to all of the care services available within that community. So somebody moves in under a continuing care contract, they move into independent living. Years later, they need care within that community. So maybe they move to the healthcare facility, and in that case, maybe they pay discounted rates for care and those kind of things. So what we're really talking about is, do you qualify for that contract? And also when they do these health evaluations, it's not just common sort of everyday things. It's not like, bad knees or bad back or something like that. It has to be a pretty severe thing. Certainly memory related issues, Parkinson's, advanced stages of cancer, things like that would obviously play a role in it. But when they're looking at this, the question is, okay, what if I don't qualify? Well, it doesn't necessarily mean that you can't move into that community. It means that you can't get a continuing care contract. So there may be availability within the healthcare center or within that assisted living setting. And if that's the type of care somebody needs, and if there is availability, now again, those services are generally reserved for residents who have a continuing care contract. They have the priority to those services usually. But if there is availability, if there's empty rooms or beds in the healthcare setting, and they allow entry from other people outside of the community into that healthcare center, then that may be an option. You would move directly in. You would not have a continuing care contract. You would not have the benefits that go with that, including the discounted cost for care. So you would move directly into care and pay the full cost, whatever that may be. If you run out of money or something like that, you would probably have to move out. So there's some differences there, but that's the thing. It's really whether you qualified for that contract or not. Now, that said, there are even some exceptions there. So I've seen some cases where a community will say, well, you can still move into independent living and you can get our continuing care contract, but we're going to put a clause in there. Basically, that says if you need care within a certain amount of time, say a year or 2 years, if you have the types of needs where you need to go to our healthcare center or something like that, you're going to pay the full cost for that care. So you get the continuing care contract, but the community's sort of going to cover their risk by saying for a period of time you would pay the full cost and you wouldn't get the other benefits of this continuing care contract within that period of time. So you want to talk to the community. There may be exceptions like that. The other question is, what if it's a couple and one person needs care and the other doesn't? Well, in that case, one person may qualify for the continuing care contract, and the question is, okay, do they need to move directly into care? If so, again, they would do so, paying the full cost and everything else with that. In some cases, maybe they can work out an arrangement where that person can receive care, paying the full cost in that independent living apartment with their spouse, if the care can safely and practically be provided through home care services or something like that. Or in some cases, maybe that assisted living community or center within that CCRC has double occupancy, where the independent living person would want to move over there with their spouse. So there's different options like that you can ask about, and different exceptions and ways that communities handle this. But the biggest point, again, is that it's really about whether you qualify for that continuing care contract, and the extent to which they look at that does depend largely on the type of contract that they offer, whether it's life care or fee-for-service or modified and so forth. So I hope that helps. And again, you can get a lot more information on this on our website and other videos.